Well, thank you so much, Dr. Robert Gore, for joining us on this conversation that is so near and dear on gun violence. Please let us know who you are and whose you are. Thank you.
How you doing? Thanks, Sister Terry, for having me on the show. I appreciate you. My name is Rob Gore. I'm an emergency medicine physician based in Brooklyn, New York. I'm also the founder of an organization called KAVI, also known as the Kings Against Violence Initiative. And KAVI is a hospital, school, and community-based violence intervention and prevention program focusing on reframing this conversation about violence and trauma within the community. We work with people who've been injured due to violence. We do preventative work to ensure that violence doesn't take place with communities that are exceptionally vulnerable. And we also do a lot of work focusing on community healing, but it's really trying to help bring a level of balance and support for our marginalized groups that are affected by violence and trauma every day. I'm also the author of a book that's come out pretty recently called Treating Violence, which is
Okay, I love it.
which is a memoir looking at my understanding of violence and trauma, my experiences growing up, practicing medicine around the world, and kind of bringing back skill sets that have been learned back home to our very vulnerable communities. But I've been doing this work. This is my 24th year as a physician, and I've been looking at violence itself, treating it for a long time, but looking at it as a public health issue for more than almost, I guess, about more than 20 years, because we're seeing
Wow.
people affected by violence, and it looks very different when you're the treating person, but then also when the people who come in who are injured or have been killed also look like you. When they're coming from the neighborhoods that you've spent time in, they're coming from neighborhoods where your family lives or where you lived, and it takes on a whole different connotation.
Absolutely.
Realize how close you are to this particular type of trauma that's claiming the lives of so many people that look like us.
Yeah, thank you. Thank you for sharing that because as you know, this is personal for me. I lost my son, Ali Sam Wayman Wisdom. I'll say his name in 21, November 5th on the Shinnecock Reservation. And I am also a member of Harlem Mothers and Fathers Save, which was founded by Jackie Rowe Adams, who lost two sons to gun violence. So, and within the group, I personally know five people that I didn't know was that situation. And I was just with someone who works with me in the schools, and we were just having a conversation, and she said something, and her son was a victim of gun violence in 2008. So this is an epidemic. It's happening everywhere. And if you just talk to people, because a lot of people don't like to talk about it, then you'll know how close this is to us. So I think that you've basically shared why, but why you're an emergency room doctor. You see this all the time. You shared the fact that it's happening in your neighborhood, you know, people that you know, you've seen this, but what was the calling that brought you to start your organization? And if you would say the name of the organization again and what the acronym stands for, what led you? Was there a trigger that made you say, okay, I got to jump in this deep water? Thank
Yeah.
you.
So there's I don't want to say this one particular trigger, but it was almost a culmination of a series of events that just kind of got to the point that I was like, I have to do something to address these issues because if not, who is? Our organization, KAVI, actually started, we were founded in 2009 as an advocacy group and then started doing actual programming in 2011 and have been continuing to do that work since, expanding, taking the work beyond Brooklyn and really helping to do everything from training people to understand violence and trauma to working with people who've been directly impacted by it. I grew up in Brooklyn. I grew up in Flatbush, and I grew up in pre-gentrified Fort Greene. But I also spent time in Atlanta for undergrad. I went to Buffalo for medical school. Uh,
Okay.
I was in Chicago for residency at Cook County Hospital, and these are all places and cities that you have that sharp demarcation between the haves and the have-nots. And when you have the haves and the have-nots, you tend to see issues related to violence and trauma. This is anywhere around the planet. But uh, I think looking, growing up in Brooklyn during the 80s and 90s, we started seeing the crack epidemic really take fold and started seeing this influx of violence that was just kind of happening at these epic proportions. And when you're a kid growing up in these spaces and you're seeing this stuff and you're hearing about it, your job is just like, I just need to get home safely from school. I need to get out in
Absolutely.
the neighborhood without any problems. And from that angle, just looking at what's required for me to be okay and then for me to be well. And then
Hmm.
you get to college and you're starting to understand a little bit about more sociology because now I'm outside of my comfort zone. I'm in a completely different
Hmm.
and I'm observing patterns. I'm like, wow, people have very different accents to them compared to what we have back home, but the
Hmm.
same issues tied to violence and poverty are still occurring. And then when I got
Absolutely.
you're starting to look at and really understanding how the human body works in its most optimal state and its most suboptimal states. But looking at the whole this whole thing about disease, like what is a disease? Understanding disease, what's pathology? How does pathology develop? How does it grow? And really trying to kind of taking and becoming a scientist of conditions that take place with the people that we're treating. A
Hmm.
disease is really any kind of abnormal condition that's going to negatively impact the normal structure and function of any kind of organism. And so you start seeing people coming in over and over and over again with the same process, kind of like if somebody's coming in with a cold, somebody coming in with an asthma attack, or somebody coming in with heart disease or problems with their diabetes. And I'm like, wow, this is the same thing that's happening with violence.
Wow.
When I was in Chicago, Chicago is a beautiful city. There's some beautiful people that are there. My family's actually from Chicago. Um,
Okay. Wow. Thank you for sharing.
my dad grew up on the west side of Chicago and in the southwest suburbs, but he was born at Cook County Hospital, which is the hospital that I wound up working at and doing my residency. But as a student, you can kind of take a side role and you're just kind of looking and just observing as a physician, a resident physician. You're a doc, but you're not licensed yet, but you're expected to take care of people. And when you're one of the few people of color in a specific place, people talk to you very differently. There weren't too many black male docs in our residency program in our hospital, and I had locks all the way down my back, so I really stood out. But a lot of the
Okay.
conversations that we had with some of the patients about what was taking place was uh, it was very different from some of my other colleagues. And a lot of the patients that we would see coming in with these different violent injuries and coming in from gunshot wounds, stab wounds, they would beat people beaten up with bats and sticks or
Mm.
any kind of object. They were always in my same age range. They came from the south side of Chicago. They came from the west side of Chicago. And when something's taking place very close to where people you love reside or it's coming from your neighborhood, it has a very different you take on a very different understanding. It's not just, man, this is crazy. I gotta fix you and make sure we keep you alive. It's like, well, where did this take place? Do I have to worry about
Hmm.
going home? Do I have to worry about going to visit my relatives over on the west side of Chicago or way on the southwest suburbs because a violent incident took place? What happens if, where the shooting take place? Where is that on the same block that my relatives live on? And so you're always worrying about what's happening. And because you're so connected to the incidents that are taking place,
Yeah, straight on the pipeline being in that emergency room. If it's happening, you see it.
yeah, you see it. Your relatives call you about it. It's like, oh, we heard there was this thing. The family's okay, and you're kind of like, man, this is crazy. But homicide is the number one cause of death for Black men ages 15 to 34.
Mm.
And when I was a resident physician and in my early days as an attending physician at Kings County Hospital, I was more likely to die from homicide than any other disease process or anything.
Wow. So number one,
Yeah,
15 to
number
34.
15 to
Well,
34, which is crazy. We're more likely to die from that than any kind of injury that or illness that you can think of for that particular age bracket. And my last year of residency in Chicago at Cook County Hospital, which is like Kings County Hospital, is like being at Lincoln in the Bronx or Jacoby in the Bronx, or
okay.
it's busy county hospital where people come from all over the planet, but it's a safety net hospital. Uh, as part of my graduation, I had to do a presentation. We do what they call a grand rounds, which is like this major presentation in front of the entire department, and people ask you questions, and it's research based. And I just had to do my presentation, my grand rounds on youth violence.
Okay. Thank you for sharing what grand rounds is. I remember being in the hospital and they were like, grand rounds is talking about you every day. So thank you for
Yeah,
sharing. I love learning.
yeah. So I did this presentation. I started looking. I wanted to present on the topic of hypothermia, like low temperature, because my presentation was in February, end of January, February. As a matter of fact,
Mhm.
I think my presentation was around now, which is so crazy to think it was that long ago.
Mhm.
I
And the
started.
weather we're dealing with right
And
now.
the weather we're dealing with, wintertime, Chicago, sub-zero temperatures, like that's the norm. So I thought, talking about hypothermia is going to be more appropriate. And my program director told me I needed to present something more meaningful to me. And then
Mhm.
a lot of different situations were happening. One particular incident where I really decided I needed to do something about it. When I was working in our trauma emergency department in Cook County, and I was on call for 24 hours, and there was nothing going on. It was like cold and it was raining, but it was the summertime. And summertime, that's when people start wilding out. And those hottest days tend to be the most violent. But this day, there was nothing going on, and it was in the mid 50s, but it was August. And one of my coworkers said that they were bored. And then a bunch of people said, yeah, we're bored. And another person said, and it might have been the same person said, I hope something exciting comes in. And a bunch
Mhm.
of
Oh,
people chimed
Lord.
in and say, yeah, we want something exciting to come in because that meant that you were going to get some sort of penetrating trauma, meaning somebody was shot, somebody was stabbed, and there was a high likelihood that you would get a chance to do some sort of trauma resuscitation procedure to keep that person alive. And I'm looking around the room, and the only two people of color that were in the room were me and one of the clerks. And I'm like, man, all these people talking about they want something exciting to come in, and we're
Wow.
connected from the community and the people who were coming in that they were looking at us like science experiments. And then I started thinking, I was like, I need to do something a lot more meaningful. I'm like, man, I need to know how to do these procedures as an ER doc, but what would happen if I made sure and I started figuring out how to make sure people don't come in for these kinds of injuries? And I started thrusting myself into this research realm about violence and trauma, looking at gun violence, looking at patterns of behavior, looking at public health, and came across the work of Dr. John Rich, Ted Corbin, and Arthur Kellerman, who were some of the
Oh.
people I had first heard of talking about violence as a public health issue. So if you understand risk factors that are
Would you
tied,
repeat that? Because we lost a little bit of that. You said you came across some people that
yes,
were dealing, yes.
looking at violence, Dr. Ted Corbin, Dr. John Rich, and Dr. Arthur Kellerman. And these were
Mhm.
physicians, internal medicine physicians and emergency medicine physicians who have been looking at violence and trauma through a public health lens. And they were the first people I'd ever seen or heard talk about violence as a public health issue. And if we're calling something a public health issue, meaning you have this disease process that's going on, or this patterns of injuries, and if you look at the risk factors that are tied to these processes that are going on, if you intervene with those risk factors, then you can kind of change the course of that health problem that's been showing itself. Kind of like when people started wearing covering up during the pandemic and washing their hands and using masks, that
Mhm.
helped decrease the spread of the infection. And then the vaccine came out, and less people were dying from complications tied to the illness itself. Kind of like with the utilization of seatbelts in cars. Before that, people were dying left and right in car
Mhm.
crashes.
Injury prevention, Harlem Hospital,
Right. Yeah, these are
bike
all
helmets.
yeah, bike helmets,
Yes.
putting up gates on windows. These are all different public health
Mhm.
measures that have been taking place,
Mhm.
been instituted to ensure that people didn't succumb from injuries or illnesses, uh, because we figured out how to protect people and prevent some of these things from happening. It didn't wipe it out, but the goal was to figure out how do you wipe out these problems. And I was looking at this work and I was like, wow, I never thought about violence as a public health issue, but it made perfect sense. You start understanding the depth of the communities that people are coming from who are being impacted, the things that contribute to these different acts of violence and trauma, and then how do you provide support for these people? I think one of the most daunting statistics that I had read back then, and it still holds true now, they're talking about when somebody comes in who's been shot or stabbed, that rate of re-injury is between 8 and 58% within 5 years. So that person is more likely to come back within 5 years for another injury. And the rate of them being killed is as high as 20%. With each subsequent and each additional injury, it increases that rate of them being killed, which is crazy. I was like, man, all these people keep coming back in over and over. But as a,
Mm,
just my basic observations as a physician, I was like, wow, how many patients have I taken care of who coming in for one injury, but they've got old scars, they've got old slash wounds from a knife or
mm,
razor injury,
mm,
they've got old, you talk to them about their history, and they're like, oh, I was shot 5 years ago or 10 years ago, or I got somebody try to run me over with a car. I remember I took care of a
mm.
guy at a
Wow.
hospital where I work right now. He got hit by a car. I was like, man, that sucks. But then I saw him the next day, and he was, I think, he got stabbed one day, and then the next day he came back because somebody tried to hit him with a car. I was like, or vice versa. I was like, man, somebody is trying to come after you. So I don't know what you're doing or what kind of stuff you're involved in, but we got to
Mm,
figure out something. But there's so many people that come in with these recurrent injuries, and these are our people who are being impacted by it. And so the work has become very personal. I moved back to New York City and moved back to Brooklyn in 2006. And after doing that presentation, my goal was to create some sort of intervention and prevention program that was focusing on violence and trauma. I decided not to just focus primarily on gun homicide or gun violence because the gun is a tool. So what's the motive behind the tool that's being used to carry out this most heinous event? And so I stopped looking at just guns as the tool itself, but looking at comprehensive contributing factors that really cause trauma, intentional trauma to manifest within our respective communities, so that we can kind of wipe it out, just like any other disease process.
yeah, I mean, this is quite a holistic approach to a situation. And I'm reflecting because as part of our gun violence series, we actually did have Dr. Roger Mitchell Jr.
Oh,
on,
that's one of the
who
homies. I've
is,
known
yes.
Roger since med school.
All
We
right. Yeah. All right. See,
met
cross-pollination.
in medical school.
But yeah, so you all, he's at Howard University Hospital and Howard University alum. But he is doing similar approaches to what you're doing. And I even think they have a medical program that young people are entering, particularly young males, Black males are entering like at eighth grade or something. So it's a holistic approach, which I think is just extremely, extremely uh, powerful and insightful because I think that that's a great approach. And also the fact that you mentioned that it's not just guns, it's whatever the weapon of choice is that is attacking people. But you said you mentioned something about the haves and the have-nots. But where does race come into this? Is race an issue?
Right. I mean, as a black male who lives in New York City, I would always say race is going to be an issue, and it just so happens that our poverty levels within our respective communities are very different from some of the other races. It doesn't mean that other races don't necessarily um, doesn't mean that they don't have poverty in those respective communities, but often the safety nets are a little bit different within our community compared to others. Anytime you
Okay.
look at a health issue that's taking place and you're trying to understand why, you have to look at the non-medical things that contribute to that process. And we
Mm,
refer to those as the social determinants of health. And social determinants of health are all the non-medical things that contribute to our overall health and well-being. If you have a community that's an uneducated population, how are they going to understand and interpret information being provided to them that's tied to their overall health and well-being? If you have a community that is in a food vacuum, I don't even want to say a food desert, because a desert is a specific ecosystem that
yes, but a vacuum.
does
Hmm.
actually thrive, but you're in this wasteland of having access to healthy food. How do you expect to heal up? You know what I mean?
Hmm.
Your body's stressed out from having inadequate nutrition, which is
And the just general trauma of, like you said, are you
trauma.
going to get home?
And you
We're constantly all looking around, looking over our shoulder. We're on alert, locking our car doors quick.
all the
So,
time. And
stress.
one thing you talked about, a little bit earlier, you talked about your sisters from Lincoln University. That is a support system that you have that you can
Yes.
put ideas and talk
Yes.
when you are in a community. and our entire social fabric has been disjointed and destroyed. You don't have those viable support systems, which help improve the quality of our stress and well-being. So that chronic and ongoing response to stress without any kind of support increases our ability for our bodies to decompensate at an alarming rate. And so anytime you have somebody who's been injured in our community, they tend not to do as well because they don't have all those determinants that have been
Mhm.
augmented to provide optimal support.
Thank you for sharing that because we know during COVID we heard a new word. I think it's, I don't know if I'm pronouncing it right, but comorbidities, you know.
Comorbidities, yeah.
So that's a whole big thing. I want to just have you say the name of your organization again. How can folks get in touch with you? I think that's very important and become a part. And where else is the organization? Is it just in New York City or where else?
So the organization is called KAVI, the Kings Against Violence Initiative, and they can check us out at kavibrooklyn.org. That's KAVIBROOKLYN.org. And that's it. We're a hospital, school, and community-based violence intervention and prevention program. Most of our work is in Brooklyn, New York, but we do a lot of advocacy work, and we do work with people from all over the entire country about our work. I just got back from speaking in Atlanta. I spoke at Morehouse College. I spoke.
All right. Alumni Morehouse.
Yeah, I'm very proud of Morehouse alumni. Happy Founders Week. Today is actually our
Okay.
Founders Day.
All
So
right.
most auspicious occasion. But I spoke at the state capitol as well about violence and trauma and mental and the impact of stress, how it relates to violence and trauma. And so we do this advocacy work all over the entire country. Actually, not even just over the country. The advocacy work is taking place all over the planet. But our
Okay.
programs are primarily in Brooklyn for right
Mhm.
now. But we are open to
Okay.
other boroughs and
Well,
other.
thank you for sharing. And when you say all over the planet, one of the conversations that we're having here today on the show is about a mass shooting that took place in Canada. And all of this has to do with the gun pipeline, coming up from the South and now in Canada. So if you'd just like to, thank you so much for closing, just share with us how successful have you been with this program?
We've been successful.
Just quickly, thank you.
We've been doing the program for over 15 years right now, and we're now at that point where the people who work with us now have the benefits to be able to do this work. They have a proper living wage to do community work. We have people who work with us who have been former participants in our program.
Hmm.
That's it's really probably the best form of paying it forward when you've been a part of our program and now you're employed by it, providing information and resources and support in the same way that you would receive. This is something we've been doing. We're continuing to do it. We provided a support for a population and our population, our community, where people were actually terrified to work with young people who've been affected by violence and trauma. They go, oh, counselors and therapists and even some cases
Hmm.
social workers were okay with dealing with somebody who's had a death because of cancer. They were okay with dealing with somebody
Hmm.
who might have been
Hmm.
unhoused. But when you had a young person, particularly young Black Latinx male who's a victim or survivor of violence, all of a sudden everybody kind of goes, oh, well, I'm not really comfortable.
Yeah, backing up, backing up. Well,
Back
Dr.
up.
Gore, thank you. We're going to have you back. This has just been amazing and really making me think about a lot of things and approach. And we're very grateful that you, as a physician, were able to widen the lens. So thank you so much, and we
Thank you so
appreciate
much.
you. And
Yep.
let's keep doing the work. Forward ever, backward never. That's where we are. Marcus Messiah Garvey. Thank you.
Thank you.
Okay. Have a great day. Take care.